Hey there, health enthusiasts. In today's video, we're diving deep into the world of supplements for heart health. We'll be exploring the latest research on popular supplements like multivitamins, antioxidants, omega-3 fatty acids, and more to help you navigate the complex landscape of evidence-based nutrition. By the end of this video, you'll have a clearer understanding of which supplements may offer potential benefits for your cardiovascular well-being, and which ones might not live up to the hype. So, grab a healthy snack, get comfortable, and let's get started on this journey to a healthier heart. Now, let's kick things off with multivitamins and minerals. Did you know that nearly half of all adults in the United States take a multivitamin supplement? It's true. According to a study by Cantor and colleagues, published in the Journal of the American Medical Association in 2016, 49% of American adults reported using multivitamins and multiminerals, or MVMs for short. But despite their popularity, the evidence supporting the use of MVMs for preventing cardiovascular disease is actually quite limited. Take the Physicians' Health Study 2, for example. This large-scale, randomized, placebo-controlled trial investigated the effects of daily multivitamin supplementation on major cardiovascular events in over 14,000 male physicians aged 50 and older. The study, led by CESO and published in the Journal of the American Medical Association in 2012, found no significant benefit of MVMs over placebo on cardiovascular events, cardiovascular mortality, or total mortality after a median follow-up of 11.2 years. Similarly, the U.S. Preventive Services Task Force conducted a systematic review of the evidence on vitamin and mineral supplements for the primary prevention of cardiovascular disease and cancer. The review, authored by Moyer and published in the Annals of Internal Medicine in 2014, concluded that the current evidence does not support the use of multivitamins for preventing cardiovascular diseases. Now, while multivitamins are generally considered safe when taken as directed, it's important to be aware of some potential risks and limitations. For instance, some vitamins and minerals can interact with prescription medications, potentially reducing their effectiveness or causing adverse effects. This was highlighted in a 2019 article by Sankara and Reisner in the journal Nutrients. Additionally, consuming high doses of certain vitamins and minerals through supplements can lead to toxicity and adverse health effects. And relying too heavily on supplements may give you a false sense of security, leading you to neglect other important aspects of a heart-healthy lifestyle, like maintaining a balanced diet and engaging in regular physical activity. The Victor Chang Cardiac Research Institute emphasizes this point in their 2023 article on heart health and supplements. Moving on to antioxidants, like vitamins A, C, E, and beta-carotene. These nutrients have been studied for their potential role in modifying cardiovascular disease risk, thanks to their ability to prevent oxidative damage to macromolecules like LDL cholesterol, which is involved in the development of atherosclerosis. Diplock discussed this rationale in a 1994 article in the journal Molecular Aspects of Medicine. However, clinical trials have yielded mixed results regarding the efficacy of antioxidant supplements for preventing cardiovascular disease. The SUV-MAX study, a randomized, double-blind, placebo-controlled trial led by Herkberg and published in the Archives of Internal Medicine in 2004, investigated the effects of a daily antioxidant supplement containing vitamins C and E, beta-carotene, selenium, and zinc on cardiovascular disease incidence in over 13,000 French adults. After a median follow-up of 7.5 years, the study found no significant differences in all-cause mortality or incidence of ischemic cardiovascular disease between the antioxidant supplement and placebo groups. A recent meta-analysis by Jenkins and colleagues, published in the Journal of the American College of Cardiology in 2018, also found no significant benefit of antioxidants for preventing or treating cardiovascular disease. In fact, the analysis showed a trend towards increased all-cause mortality in those taking antioxidant supplements. It's worth noting that some studies have suggested that high-dose antioxidant supplements may actually increase the risk of all-cause mortality, as discussed in the Jenkins meta-analysis. Antioxidant supplements may also interfere with the effectiveness of certain cancer treatments, like chemotherapy and radiation therapy, as mentioned by Sankara and Reisner in their 2019 Nutrients article. Another important consideration is that dietary supplements are not subject to the same rigorous testing and regulation as prescription medications, making it difficult to ensure their purity, potency, and safety. This lack of regulation is a key limitation of supplements, as highlighted by Sankara and Reisner. Next up, let's talk about folic acid, a B vitamin that's been investigated for its potential role in reducing cardiovascular risk by lowering plasma levels of homocysteine, an amino acid positively associated with increased cardiovascular disease risk. Bushi and colleagues discussed this association in a 1995 article in the Journal of the American Medical Association, and Ganguly and Alam further explored the role of homocysteine in cardiovascular disease development in a 2015 article in the Nutrition Journal. The China Stroke Primary Prevention Trial, or CSPPT, a large-scale randomized controlled trial involving over 20,000 adults with hypertension, examined the effects of enalapril, a blood pressure-lowering medication, with or without folic acid supplementation, on the risk of stroke. The study, led by Huo and published in the Journal of the American Medical Association in 2015, found that the combination of enalapril and folic acid significantly reduced the risk of first stroke by 21% compared to enalapril alone, particularly in participants with low baseline folate levels. However, it's important to note that the CSPPT was conducted in China, where there is no mandatory folic acid fortification of food, and the population has lower baseline folate levels compared to countries with fortification programs, like the United States and Australia. Therefore, the generalizability of these findings to populations with higher baseline folate levels may be limited. It's also worth mentioning that high intake of folic acid can mask the symptoms of vitamin B12 deficiency, potentially leading to delayed diagnosis and treatment, as noted by Sankara and Reisner in their 2019 Nutrients article. Folic acid supplements may also interact with certain medications, like anticonvulsants and methotrexate, potentially reducing their effectiveness. Moving on to omega-3 fatty acids and fish oil. These nutrients, particularly eicosapentaenoic acid, EPA, and docosahexaenoic acid, DHA, have been studied for their potential cardioprotective effects. They may help lower triglycerides, increase HDL cholesterol, and slightly lower blood pressure, as discussed by Sankara and Reisner in their 2019 Nutrients article. Prescription fish oil, containing high doses of EPA and DHA, is used to treat severe triglyceride disorders, not high cholesterol. These medications can reduce triglyceride levels by 30 to 50% in individuals with levels of 500 mg or higher. However, over-the-counter fish oil supplements may contain lower doses of active ingredients and unwanted saturated fats that could increase LDL cholesterol levels. The evidence supporting the use of fish oil supplements for preventing cardiovascular disease in the general population is mixed. A recent meta-analysis by Abdelhamid and colleagues, published in the Cochrane Database of Systematic Reviews in 2020, found that omega-3 fatty acid supplementation had little or no effect on cardiovascular mortality, coronary heart disease events, or major vascular events. It's important to be aware that some over-the-counter fish oil supplements may contain saturated fats that can increase LDL cholesterol levels, as mentioned by Sankara and Reisner. Omega-3 fatty acids can also interact with blood thinners, like warfarin, increasing the risk of bleeding. Additionally, fish oil supplements may contain contaminants, such as mercury and polychlorinated biphenyls, PCBs, which can have harmful health effects. Now let's shift gears and talk about fiber. Dietary fiber, particularly soluble fiber, has been shown to help improve LDL cholesterol levels, control blood sugar, and decrease the risk of type 2 diabetes, as discussed by Hodson in a 2023 article. While it's best to obtain fiber through a diet rich in fruits, vegetables, whole grains, and legumes, some individuals may benefit from fiber supplements if they struggle to meet their daily fiber needs through diet alone. A meta-analysis by Sarampudi and colleagues, published in the journal Current Atherosclerosis Reports in 2016, found that soluble fiber supplementation significantly reduced total and LDL cholesterol levels in both healthy individuals and those with hypercholesterolemia. The analysis also found that higher doses of soluble fiber, greater than 3 grams per day, and longer durations of supplementation, more than 4 weeks, were associated with greater reductions in cholesterol levels. However, it's essential to note that fiber supplements should not be used as a substitute for a healthy diet and lifestyle. Consuming a variety of fiber-rich foods provides additional nutrients and health benefits that may not be obtained through supplements alone, as emphasized by Hodson. Fiber supplements can also cause gastrointestinal side effects like bloating, gas, and abdominal discomfort, particularly when initiated at high doses. They may interact with certain medications, such as antidepressants and cholesterol-lowering drugs, potentially reducing their absorption and effectiveness. And fiber supplements in tablet or capsule form can pose a choking risk, particularly in older adults or those with swallowing difficulties. Next, let's discuss magnesium, an essential mineral involved in numerous physiological processes, including heart function. Higher magnesium intake has been associated with a lower risk of diabetes, high blood pressure, and metabolic syndrome, as noted by Sankara and Reisner in their 2019 Nutrients article. A 2022 study by Salahidast and colleagues, published in the journal Scientific Reports, investigated the effects of daily magnesium supplementation on cardiometabolic markers in individuals with prediabetes. The double-blind, randomized controlled trial found that 12 weeks of magnesium supplementation at a dose of 250 milligrams per day was associated with a significant increase in HDL cholesterol levels compared to placebo. However, more research is needed to determine the optimal dosage and duration of magnesium supplementation for cardiovascular health, as well as its long-term effects on cardiovascular disease risk and outcomes. It's worth noting that high doses of magnesium supplements can cause gastrointestinal side effects like diarrhea, nausea, and abdominal cramping. Magnesium supplements can also interact with certain medications, such as antibiotics and diuretics, potentially reducing their effectiveness or increasing the risk of side effects. And individuals with impaired kidney function may be at risk of magnesium toxicity when taking supplements, as the kidneys play a crucial role in regulating magnesium balance. Finally, let's talk about coenzyme Q10, or CoQ10. This antioxidant is naturally produced by the body and involved in energy production within cells. Some studies suggest that CoQ10 supplementation may help lower blood pressure and reduce the side effects of statin drugs, like muscle pain and weakness, as mentioned by Sankara and Reisner in their 2019 Nutrients article. However, the evidence supporting the use of CoQ10 for preventing or treating cardiovascular disease is limited. A meta-analysis by Flowers and colleagues, published in the journal Atherosclerosis in 2014, found that CoQ10 supplementation had no significant effect on cardiovascular disease risk factors, like total cholesterol, LDL cholesterol, HDL cholesterol, or triglycerides. Additionally, while some individuals take CoQ10 to help alleviate statin-induced muscle pain, the overall scientific evidence does not support its use for this purpose, as noted by Sankara and Reisner. It's important to be aware that CoQ10 can interact with blood thinners, like warfarin, potentially increasing the risk of bleeding. And as with other dietary supplements, CoQ10 products are not subject to the same rigorous testing and regulation as prescription medications, making it difficult to ensure their purity, potency, and safety. In summary, the current evidence fails to support the use of most vitamin and mineral supplements for the prevention or treatment of cardiovascular disease, as concluded by Sankara and Reisner in their 2019 Nutrients article. While some supplements, like folic acid and magnesium, may offer potential benefits for specific populations or individuals with certain risk factors, the overall evidence for their efficacy in preventing cardiovascular disease is limited. It's important to emphasize that a healthy diet rich in fruits, vegetables, whole grains, and lean proteins remains one of the best defenses against heart disease, as highlighted by the Victor Chang Cardiac Research Institute in their 2023 article. Supplements should be used to address existing nutrient deficiencies identified through blood tests and should be discussed with a healthcare provider to ensure safety and appropriateness. Certain dietary modifications, like consuming fatty fish, increasing fiber intake, and maintaining adequate magnesium levels through diet or supplementation, may provide some heart health benefits. However, it's crucial to approach supplements with caution, as they can interact with medications, cause adverse effects, and may not be subject to the same rigorous regulation as prescription drugs. Ultimately, the decision to use supplements for heart health should be made in consultation with a healthcare provider, taking into account an individual's unique risk factors, dietary habits, and medical history. By prioritizing a healthy lifestyle and evidence-based interventions, individuals can take proactive steps towards maintaining cardiovascular health and reducing their risk of heart disease. And that's a wrap on our deep dive into supplements for heart health. We hope this video has provided you with valuable insights and information to help you make informed decisions about your cardiovascular well-being. Remember, while supplements can play a role in supporting heart health, they should never replace a balanced diet, regular exercise, and other healthy lifestyle habits. If you found this video helpful, be sure to hit that like button and subscribe to our channel for more evidence-based nutrition content. And don't forget to visit nutritionmarket.com.au, where you can find a wide range of high-quality supplements and access our virtual clinic with clinical nutritionists and naturopaths serving clients in Australia and around the world. Book a consultation today to get personalized advice tailored to your unique health needs. As always, please keep in mind that the information provided in this video is for educational purposes only and should not be considered a substitute for professional medical advice, diagnosis, or treatment. If you have any concerns about your heart health or are considering starting a new supplement regimen, be sure to consult with your healthcare provider first. Thanks for watching, and until next time, take care of your heart and stay healthy.